I'm talking here to Rand Hodson, and Rand is a self-employed American, but he does not qualify for health insurance. Rand, can you tell us your situation?
Sure. Because of my coronary artery disease and my heart bypass, no insurance company will qualify me for my pre-existing conditions, and so you can't buy public, as you want to call it, over-the-counter health insurance. The only thing I can qualify is for the pool in Missouri, which runs me at my age about $9.75 a month.
So how long has it been since you've seen a doctor, Rand?
About 2 years, 2.5 years.
And as a former, or as a cardiac patient, it's been 2.5 years since you've seen a doctor?
Yes.
And do you have medications you need to take?
I do.
And do you take them?
Well, I don't have them now because I don't have any scripts. I haven't had them for 2 years.
You haven't had medication for 2 years?
Right, about 2 years.
And this is the situation of a self-employed American in the year 2009.
Yes.
With a pre-existing condition.
Mm-hmm.
You're uninsurable, is that what you'd say?
That's what I'm saying, yeah. For health insurance, yes. For life insurance, too, but for health insurance, yes.
You're uninsurable?
Yes.
Okay, and Rand, what would you say to members of the United States Senate who are debating whether health care should be a right to all Americans?
I'm actually from Canada originally. I'm a resident alien here. My wife's an American. And I think it's crazy that we have a corrupt system that's ridiculous that we don't cover all our people. As humanitarians, we should have basic insurance for everyone, and people should have access to health care. It's not a choice. And they should be able to buy meds at a reasonable price. And we have done crazy things in this country when it comes to medical. And I like the Canadian system 1,000 times better, and I think anything's better than what we have, because right now we have a lot of people I know walking around without health insurance, can't get any coverage. And it's not just a matter of when they do get coverage, the deductibles are obscenely high, $5,000 and things like that, where regular folks can't even afford that kind of insurance if they have to use it.
And if there were not this clinic today, what are you doing for your health care?
Really not doing a whole lot. Just sliding forward. So, no, you can't. Without the scripts, you can't buy the meds, and I should be taking the meds. But without the insurance, it's almost impossible. The cardiac doctors charge more, actually, if a patient comes in off the street cash than they do for if you have your insurance. So, and the problem is not just that, it's anything else that I have is just not covered. So,
are you angry at the breakdown of our healthcare system?
Yeah, I am. I think it's ridiculous. It's unjust, inappropriate, and really does a discredit to the whole United States country. When you look at the G7 countries, the other economic countries globally, they don't treat their people this way. And at least I have some means that I could address something if it was really significant, severe, but there are so many people who don't. And it just goes to show the state of affairs we're in. And, the senators and the reps need to look at, and the Senate itself needs to look at their insurance coverage they offer because of the group they're with. They're able to get it. But the pre-existing condition factor and whatever factor, it's not something we've chosen in life. It's not something that I caused. It's genetic disability that affects people. Why are we limiting people's access to basic human rights because of something they're born with or whatever the scenario they may be at? So I am displeased with what they've done and really think they need to relook at this in a more humanitarian situation and come up with options that are reasonable for common folks to do and to be part of. And everybody should be covered. And I really think the rates would go down drastically. I think some changes would happen drastically if we reform the system. But the system is broken drastically, and it's been breaking for years, and everybody knows that and is turning the other way.
Okay. Thank you, Rand, and I try and take good care of you today.
Thank you.